Hello, my name is Stacy Schmiel. I'm proud to be the registered dietitian here at Healthy Living Dallas. Here at Healthy Living Dallas, we run a very extensive lab panel for our patients that includes a variety of measurements, including a lipid panel, a vitamin D status, a CoQ10 level, male and female hormones, an omega-3 and omega-6 panel, as well as an inflammation panel and more. We are going to focus on the inflammation marker part of the panel for the next few minutes. One of the markers we monitor is called highly sensitive C-reactive protein, or hs-CRP. This is a blood test that measures the amount of protein called C-reactive protein in your blood. C-reactive protein measures general levels of inflammation in your body. In the sensitive format that we measure this is also a useful marker for determining risk of cardiovascular disease, heart attacks, and strokes. One of the most underestimated obstacles in fertility is inflammation. According to a 2014 study published in the journal Seminars in Reproductive Medicine, showed that inflammation can throw estrogen and progesterone, the two main hormones involved in the menstruation cycle. These hormones can be kind of thrown out of rhythm. When these two hormones are out of balance, it's nearly impossible to get pregnant or take a baby to full term. So what can cause a high C-reactive protein? Many functional medicine professionals will agree that the following factors can contribute to elevated inflammation, which is reflected in the high CRP level. Processed foods, especially those high in simple sugars, hydrogenated oils, and high fructose corn syrup, which promote bacterial overgrowth in the small bowel. Insufficiency of fiber, which helps pull toxins from the GI tract and acts as a broom to sweep them out. Insufficient phytonutrients, like those found in fruits and vegetables, nuts, and seeds. Eating a high saturated fat diet that is also high in arachidonic acid, such as that found in meat and dairy. Food allergies, in which the person continues to eat that particular food item. An abnormal lipid panel, elevated triglycerides, elevated total cholesterol, low high-density lipoprotein can also cause inflammation. Chronic disease left untreated, such as diabetes. Obesity and being overweight, specifically in the presence of visceral fat, the type of fat that occurs inside the abdomen around the internal organs, as opposed to subcutaneous fat under the skin, is associated with increased levels of inflammation as well. An elevated homocysteine level, chronic stress and lack of relaxation or sleep, lack of exercise and movement, vitamin D deficiency, a fatty acid imbalance in which omega-6 is much higher than omega-3 and the diet is rich in saturated and trans fats. Next we're going to talk about what you can do to help correct your elevated CRP or chronic inflammation. Exercise. The World Health Organization recommends adults aged 18 to 64 should do at least 150 minutes of moderate intensity aerobic physical activity throughout the week, or do at least 75 minutes of vigorous intensity aerobic activity throughout the week. You can also eat the rainbow of foods daily. This would be like eating a red vegetable, a green vegetable, purple, a blue fruit, so a different color with each of your meals. The Institute of Functional Medicine actually recommends aiming for 9 to 13 servings of fruits and vegetables each day. A typical serving would equal half a cup of cooked vegetables, 1 cup of raw leafy vegetables, or a medium-sized piece of fruit. Weight loss is also recommended if you are overweight or obese. Invest in a good quality probiotic specific to your individual needs and symptoms. Steer clear of known allergens and be aware of increasing food sensitivities as well. Gluten, eggs, dairy, soy, and nuts are some of the most common dietary irritants. Support phase 1 and 2 of the inflammatory response. Avoid trans fat found in chips, sweets, and fast food. Normalize your vitamin D levels. Balance your omega-6 to omega-3 fat ratio, both in your diet and with a good quality EPA-DHA supplement if needed. Normalize your blood pressure. Normalize your insulin sensitivity with a low glycemic diet and movement. Reduce your exposure to free radical damage and heavy metals. If you are interested in seeing if inflammation is a concern for you or a potential future pregnancy, schedule your new patient appointment at Healthy Living Dallas to assess your CRP and many other pregnancy risk factors, as well as learn about lifestyle habits that will reduce inflammation and keep it at bay. We look forward to meeting you. Thank you.